return on time so that we can start on time and end on time. That's always our goal. But we do have a lot of information to cover today. And also, when we go on breaks, in addition to lunch, any breaks are going to be short and brief. Please get back on time so we can resume and keep the ball rolling. Other than that, welcome back to Family Workshop. We're so glad you're here, and turn it over to Warden Brandy.
Thank you, Ryan. Ryan has the thankless job of being the fun police. And so it takes quite a bit to coordinate 250 people across three different locations and virtual. So welcome everybody. To those of you I haven't met yet, it is wonderful to be here in person with you. My name is Ward Blanchard. I'm one of the founders and a therapist here at the Blanchard Institute, and super excited to be here with you guys. And Eric, are we good live and virtual? All right, good to go. It is really exciting to be here this weekend. This is probably our largest weekend yet. And to tell you that, and actually to have Brandy here, who's getting ready to introduce herself, is really special as well. You know, we started this workshop even before the Institute existed, about 5.5, 6 years ago. And, you know, we were in sort of a little, almost like a little cubby hole with 17 people. And now to have, you know, nearly 300 and to have it broadcasting virtually, you know, last time there were people attending from overseas in Europe is just truly amazing. We really want to provide this platform to as many families and clients as possible. So truly exciting. And that being said, even in the beginning, the first couple years, my colleague next to me has participated in several workshops. And as you heard me talk a little bit about yesterday, we talked quite a bit about the healthcare system and how it's not set up to help you guys. And at the same time, you hear me say, follow the professional direction. And believe me, I'm well aware of that hypocrisy of when I'm saying following the professional direction, yet 98% of the healthcare professionals don't know how to guide you guys. One of the opportunities that we get with this workshop is to provide you guys direct access, you know, to some of the industry's top professionals. And in my mind, they don't get any better than the person standing to my left. And Brandy is a owner and operator of a treatment center that we work with, and I'll let her introduce herself.
Sure. Thanks. Hi, I'm Brandy Klingman. I'm from Louisiana, Baton Rouge, Louisiana. I am a friend of Ward's, but also an admirer of the Blanchard Institute. I've been a fan since the beginning. I've kind of gotten to see you guys grow over the years, and it's been impressive. This is, just so you know, this is an impressive amount of people involved in a family workshop. Tanya and Elizabeth and I all flew in, and we all own treatment centers, and we've never seen a workshop this way, and it's tremendous. So you have a lot to be excited about. I do own a treatment center in Louisiana, a men's only treatment center, and I've been in the field as a clinician for almost 20 years now. So I've been in it for a minute, longer than I'd like to admit sometimes.
You started when you were real young.
Yeah, I started as a baby.
Yeah.
And so I've seen a thing or two, so nothing's going to really scare me. My specialty area is around differential diagnosis, like working things out. So any of you who know a little thing about substance abuse, so usually it's paired with some other mental health issues. And so we kind of figure out what's leading the problem here and what's the real cause underneath here. And then also in substance-induced psychosis. So I deal a lot with that, and also around policy so that we can get better access to healthcare providers who are trained, because as Ward says, you don't always meet the best clinicians, which is very scary because you're dealing with a life or death situation and a chronic and terminal illness in a lot of ways, and you really need to have good clinicians. So unfortunately, a lot of times you'll go to a clinician and feel like you're doing the right thing, and it's someone who doesn't have any skill set or training, and they're practicing beyond their scope. And so it's a false sense of safety that you get sometimes from the person sitting on the other side of the desk. So Ward's good about screening people. I try to be pretty good about screening people and letting them know we don't really think they're great, you know. So we'll help you out through today.
Yep. Well, thank you, Brandy. So last night, you guys, we were all here to really talk about the catalyst of what brought us all here. You know, we talked throughout last night that this entire weekend, the material builds on itself. And so we're going to go through just a little bit of a review since, you know, I do know that last night was like drinking out of the fire hose a little bit. And I really, much like I said yesterday to the crowd yesterday, I really want today to be as much of an interactive exercise. Yesterday was as much of us talking in one setting that you are going to hear. This is the opportunity for you guys to ask questions, give feedback. Like I said, there is no silly question. You know, when we go and talk to medical professionals, which we do every week, we spend a lot of our time giving back to the community, and like we're the continuing medical education providers for Atrium and Novant. And when we're talking to internists and psychiatrists and medical specialists, they don't even understand. So trust me, there is no silly question. And so now's the opportunity for you guys to ask. So like I said, last night we started to talk about the catalyst to what brought us all here on both sides of the equation. There's the identified patient, you know, and the family, that mental health condition, that substance use disorder, and talking about what is the family disease. And when you hear and hear the terminology family disease, what exactly is that? What is that? What is the tangible process? And you know, that's the way that you guys come in here. You guys came in here at 5:30, a little uncertain of what to expect. Some of you guys probably knew each other from you know, being in treatment, but you know, most of the family members didn't know what to expect, or like I said, maybe you'd been to a traditional family workshop and so you had preconceived notions. But we talked yesterday about the ultimate goal that we have for you this weekend. And so when we talked about what that goal was, what did we identify was really the goal of this weekend? And you guys, what do you say you guys' goal is? Change, right? That at its highest level, everybody in this room comes in here with something that they want to change. It's not about right or wrong. You can hear that that's actually terms that we don't use this entire weekend, right or wrong, because it's not about character or choice. It's about what's healthy and functional and about what's unhealthy and not functional. And everybody in this room, although I don't know the specific scenarios with every single family situation, but I can tell you, my guess is everybody in this room wants to be happy, healthy, and more connected. You guys come to this workshop in some degree of chaos, pain, and discomfort, and want to get healthier, want to change the current dynamic in your life and your family's life. And so at its core, you know, we're after change. And why that's so important to understand at its basic level is because I can't tell you how many workshops that I go to and how many family programs that even some of you may experience. You'll go to and you'll have an emotional time and you'll shed tears, but does it translate to change when you leave there? Like when you go back home and you leave the weekend and you go back home Monday, do you get back into your routine and just kind of forget what you learned? And so our goal is, this is really a jumping off point. Application is the key to transformation. And so the whole curriculum today is based in how do we motivate and empower that change. That's why we're going to go through all sorts of different exercises. And the two experiences, when you're talking about just even understanding the study of human behavior, when we look at the core experiences that people need that really drive human behavior, you know, empathy and perspective shift. These are two words that we referred to last night and that we'll keep referring to. And hopefully last night, by the end of the night, you guys really began to understand what we mean by empathy. That some of that information, most of that information, you know, communicated the way it was new. I know some of that, like I said, that family research and that family brain, that was just published in 2019 and 2020. So unless you've been here before, that was the first time many of you have seen it. And so that information, hopefully you guys begin to separate the disease from the person. You know, when you begin to have that empathy and understanding, you know, beginning that awareness is what we're here to give you, that awareness of understanding why, what's happening to my loved one, what's happening to me. When you have that accurate information, it allows empathy to creep in. When you allow empathy to creep in, that allows you to hear more, that allows you to be aware more, and hopefully receive some of the information that we're going to have to talk to you about today. So empathy and that perspective shift is really what drives human behavior. And hopefully throughout today, you guys will take from here and you guys will be able to apply some of the changes that we're going to empower. I cannot tell you how often that we have to remind identified patients and family of this image. I can tell you that it's very common, because let me remind you, both identified patients and family members do not have, properly working frontal cortexes right now. And that's executive functioning, common sense, judgment, reasoning, problem solving. So you can understand why even identified patients and family members, you have to, educate and tell them things time and time again. Just because the nature of your cognitive functioning, it's very difficult to retain things. When the frontal cortex isn't working properly, that's the language part of the brain. And so we're going to continue to reiterate, the fact that our brains just aren't working properly. When we talk about a brain disease, especially with the identified patient, untreated mental health conditions, substances of abuse, like I said, they all affect the body differently. But in the long run, they affect the body and the brains the same way, and they shut off the frontal cortex, severely diminish it. That's why executive functioning, common sense, reasoning. That's why the most common statement I hear is invasion of the body snatchers, Dr. Jekyll and Mr. Hyde. That's why that, the person that you married or person that you raised that's struggling with this doesn't act like the person that you once knew. And so their brain is not working properly. And so the one question that we always ask, especially when it comes to treatment and the professional recommendation, is to keep reminding you is how many of you guys would trust somebody with this cognitive functioning to have any influence over your life or death treatment plan? I've asked that question to people for 10 years. I've never had anybody say that they trust that. And just an understanding that that's what we're working with. And like we said, it comes back, that neuroplasticity, the retraining of the brain's pathways, it comes back. That's why we say it takes 2 years to stabilize this in a family system. It was never the medical community or any sense of medical research that said 30 days was anywhere, shape, or form any benchmark toward healing, let alone 30, 60, 90 days, or the silliness that sometimes you read that it takes 72 hours to detox. Heck no, I said it takes every bit of 60, 90 days to detox. Every bit of 2 years to stabilize, every bit of a year. I tell identified patients and families to measure your expectations. That first year, we have this natural human tendency to want to get everything back, that we've got this shame, disappointment, and depression for not accomplishing or not fulfilling so many things while we were sick. And that first year, we want to get everything back that quick. The fact of the matter is, if you get through the first year sober and alive, everything else is a cherry on top. Sober and alive, and everything else is a cherry on top. And if you do that, you're actually part of some of the rare few. If you do that, that is an enormous accomplishment. If you get through that first year sober and alive, family members, I can tell you, you should just hit your knees with gratitude. So they're sober and alive in a year sober, and that is an amazing accomplishment.
I'll say something there too.
Yeah.
I think families tend to have an unrealistic expectation around this level of need. So when we have a long-term treatment center, so people are there with us usually 6 to 8 months. And within the first 30 to 90 days, because of what media tells you, a lot of families are expecting, well, he did a long-term program. He's been there 60 days or he's been there 90 days and he physically looks better. So within the first month or two, you're going to really see a lot of change physically. They're going to look better. They've gained their weight back. They're, brighter in their eyes, happier, talking more, that kind of thing. But really, you're not seeing what's going on neurologically. So the mom and dad, like, well, he looks better. He's talking better. I'm coming up and visiting him. He's saying all the right things. He wants to go to school. He wants to come home. He wants to get a job, whatever these things are. But they're not understanding the neurobiology behind it, that there's still some damage to the brain. And so statistically, when we're measuring outcomes, you see the average person goes to treatment over 8 times in the United States before they get well. And that's a lot of money, it's a lot of time, and it's a lot of chance for death. And I think part of the reason is because the media's influence on families telling them that it's 30, 60, 90 days and they're better. When really, in reality, that's not true for this disorder, this medical illness, and it's not true for most medical illness. It takes a while to recover. And if we said, oh, you have terminal cancer, I'm gonna give you 30, 60, 90 days, no one would expect after that that you would never have any kind of symptoms. You still have symptoms, it's just underneath what you can see. And the same is true about this one. So you take this guy out at 30, 60, 90 days, he's going to be making this, or woman, they're going to be making the same decisions and same symptoms that they were before within minutes, really, because we're neurobiology, we're not up to where we need to be. So I think that's where it's sometimes people want to blame the treatment wasn't effective, but really the duration wasn't long enough. And that's what we have to kind of start looking at now. And Ward does a great job of this. And his place is your expectations within those first 90 days should not be what you had previously. So after this family workshop, I think that will be very helpful to you guys.
There's no question, like we said last night, like the brain heals through consistency, not intensity. The brain heals through consistency, not intensity. Like the brain heals it's not like like I said, you don't get in shape because you go to the gym 48
Right.
hours in a row the first weekend of January. It's not that intensity. It's not like I'll go to a treatment in a 30-day
would.
treatment center. That way I don't have to do a long-term outpatient. It's just not how it works. You know, we know the longer you stay in treatment, and that's actually step-down treatment. It's like, all of the treatment, what we know when it comes to treatment, tailored step-down treatment goes along with how the brain heals. I mean, if you think about it, if your frontal cortex isn't working and you're just activating off your limbic system, you need more structure. So that starts with 5 days a week. And then as your brain heals and the frontal cortex comes back online, you step down in treatment 4 days a week, 3 days a week, 2 days a week. And then by the time you're 6, 7 months sober, your frontal cortex is a little bit more back online and you're in recovery management, which is far more individualized. Because your frontal cortex is back online, you can do a little more individual services. So many times we see families say, well, they need one-on-one when they're in 30-day treatment center, when their brain's not even working.
Mhm.
Trust me, one-on-one psychodynamic therapy when you're under 90 days is not that effective. It is not that impactful. Is it something that's helpful? Absolutely. Do we include it? Absolutely. But it's not nearly as effective as when you're 1 and 2 years sober. And so the understanding that, you know, the entire treatment spectrum is all based in evidence-based in how the brain heals. And that takes a lot longer than what we're made to think. And see, the problem that you guys experience, and Brandy referred to this, is when you're going to 6, 7, 8 treatment centers and you're going to the doctor and the GP or maybe the therapist, and they're giving you all this inaccurate information, you know, it compounds that stress and frustration that you guys feel. It compounds that chronic stress. And so this absolutely, whether you guys realize it or not, is how you enter this weekend. You're trauma bonded onto the identified patient. That's what that image looks like. It's trauma bonded onto the identified patient. I can't tell you, in working with families, how many that we ask the family members how they're doing, and they absolutely answer you according to what they know about the identified patient. And then many of you guys, if you've been to Thursday nights and I'm facilitating it, and we'll do a check-in, and most of the family members will start checking in. Well, so-and-so is doing well. And I'll say, no. How are you doing? I'm not asking how your loved one's doing. I'm asking how you're doing. And you'll start, when somebody asks you how you're doing, you'll start telling them about your identified patient. Because that's what dictates how you're doing. That's that trauma bond that everybody feels. And way too often, you guys, both patients and family members, are shamed for this in traditional language. They're called codependents and enabling. And it does you guys a great injustice because you guys are really trauma survivors. We talked about, and that's really important to understand, because the trauma is, and the impact that has on you guys' cognitive functioning is really gives you guys awareness of what's behind some of you guys' behaviors, you guys' symptoms, those defense mechanisms that come up in the middle of this chronic stress, you know, are the result of trauma. It's not a result of unhealthy choices that you guys are just trying to make unhealthy choices. It's just very understandable human reaction to substantial amounts of trauma. And this reality, like it is not exclusive to just substance use disorders and mental health. Like we said, any family that has somebody with a progressive illness, the family members are 5 times more likely to be in the hospital. The family members. And it's not codependency or enabling. Like I said, it's called the stress coping paradigm. Or caregiver stress is often what it's called. You often find this in nurses in the helping profession because their job is so intense and so stressful that they actually suffer from caregiver stress. It's very real and very tangible, very measurable, and it takes its toll. It takes its toll. That's why we say with active and untreated mental health and active and untreated substance use disorders, there's no intimacy exists in a family. It cannot exist in the middle of that crisis. When you have that crisis and constant turmoil and constant solving the next immediate crisis, intimacy, that intimacy you see, intimacy cannot exist, no matter who has the disease. It's just the reality of what happens to a family because of the trauma. So the healing process that takes, you can understand now when you're talking about 30, 60, 90 days, it's not just about stopping the chemical consumption or stabilizing the mental health issue. There's so much healing when it comes to the family. That's why the entire rest of today is really going to talk about that catalyst that we're reviewing right now that we talked about last night. What happens when that catalyst intersects a family system, like throwing a rock into a pond and the ripple effect that it has, impacting everybody involved. And so the rest of today is really about normal family stuff, not really exclusive to substance use disorders or mental health. How does a family operate? What happens when a family intersects with such significant trauma? What is it that happens, that ripple effect? How do we become aware of it? And then what do we do about it? What can we do about it? And I can tell you the first thing that we need to realize is when it comes to making the change that is our goal, how good are you at changing other people's behavior? Like I said, we're all surrounded by autonomous people that don't behave as we think they should. We're not in control of anything beyond our nose. So how in the world am I able to support, love, help create change if you can't control anybody else? And so that's why the entire conversation about helping to adjust this reality and create that change is about each one of you creating the change yourself. And so when you're talking about creating that change yourself, you've got to become aware of when you're talking about creating the change and creating the solution, you've got to really, truly understand the problem. That's why we said that when we talked about the identified patient's brain, like we just went over, versus the family member's brain. And that chronic stress, that's why, some of you family members, when we're, talking about this chronic stress and trauma, you're sitting there nodding your head, you know exactly what I'm talking about. The intensity that you feel, you can judge the temperature of the room right when you walk in it. You've got that constant radar going. It's what chronic stress does to the brain. No matter what happens, chronic stress, you can teach your brain to live in a chronically threatened environment. The brain, even as adults, it still is permeable. You can teach an old dog new tricks. You can. It's not as easy when you're younger, but you still can do it. And so the reality is that when you have this chronic stress all the time, it teaches your brain to live in this chronically threatened environment. And that's how you family members and loved ones feel. Judge the temperature of the room. Some of you guys may have experienced overdoses in your house or, car wrecks, or, it's not exclusive to just substance use disorders. Like with my healthcare condition, those you parents out there, when I was, healthy as a horse, and 2 weeks after I accepted Athlete of the Year, I kicked down my parents' bedroom door in the middle of the night, unable to breathe, turning blue. They shot up like a bolt of lightning, and, we were off in an ambulance and a series of hospital visits. And how much sleep do you think they got after that and years followed that? You parents don't, still to this day, they react to the cadence of my breathing. So that'll never go away. It doesn't have the same impact on them as it did 20 years ago, but it'll never go away. They still have it. It's still an impact of the trauma. And so it's not just exclusive to this, it's just a human response to the trauma. It's not anything that you guys should be shamed for. It's just a very natural and understandable human response. And so that stress and that anxiety, it's important to understand because it just doesn't go away. There is a difference between stress and anxiety, just so you guys know. Stress is much more external, much more tangible. like when a bear's coming at you, that's real, that's stressful. As opposed to you can just think about it, internal. Anxiety is much more internal. That's why we also talked about last night, time doesn't just heal all wounds. Because you can be by yourself for 2 years and still be anxious as hell, working yourself up just internally. You know, stress and anxiety, although different to your body, it's arbitrary. Whether it's real or perceived, your body doesn't know the difference. And if you don't believe me, if I shut off all the lights and said there's a bunch of snakes and spiders on the floor, it's going to freak some of you guys out, whether it's there or not. It's because to your body and to how your body responds, the difference is arbitrary. Whether it's real or perceived, it still has the same impact on you physically. I mean, how many of you family members get that catastrophic thinking that's a result of that trauma that you guys feel when you send a text or don't get it back, or you read a Facebook message, or you see anything that may trigger you, and all of a sudden somebody's dead in a ditch somewhere. Or my gosh, if I hold this healthy boundary, they're going to be homeless, they're going to be dead, and it's all going to be my fault. That catastrophic thinking, because in the absence of data or the absence of facts, we will tell a story in our head. And that's just a very natural reaction. And some of you guys, it's valid. Like my parents worrying about my breathing is valid because they had this true experience. You know, I talked to a dad about a year ago whose loved one had overdosed 17 times and he carried Narcan in his pocket. And so you can imagine that he's a little jumpy, but that's PTSD, right? It's just like a veteran come back and reacts to fireworks. It's very real. And it's professionals' duty to help you navigate that, help you talk about it, to identify it. And it's our job to do that. That's why I said our job is not customer service. Our job is still be kind, but our job is to have those uncomfortable conversations and identify those symptoms. And it's not an indictment on parenting or an indictment on somebody's marriage. It's just a conversation about PTSD symptoms. And that's the duty of what a professional should do and help you navigate through this. But that stress and that anxiety, both sides of this equation feel. And that chronic stress and that chronic anxiety, the impact of that on your brain is profound. The stress that you guys feel, we talked about the stigmas that compound. All of this skews your objectivity. All of this factual, this is all biology, it's not psychology. And all of this highlights one of the most important facts about receiving treatment is identified patients and family members with not working properly frontal cortex, non-medical professionals do not need to be dictating the medical care. This is just like any other medical disease. The more you follow the professional, the trusted professional, the more you follow the treatment plan, the better the prognosis. And if you start Googling WebMD or letting emotions drive it, prognosis is not good. You know, and that's the impact that this stress and trauma has. Like I said, and it's not, a lot of this isn't choice, much like the identified patient. We tell you guys go through a parallel process. Like I said, you guys have this rooted in your DNA. You know, years ago when I was working in California, I helped this father named David with his son, Nick. And the father, David, was 30 years sober himself off of an IV heroin addiction. And his son, Nick, developed a opioid disorder. And he was chasing him down in alleys, kicking down motels, and, you know, standing down drug dealers into his disease, just trying to help. Came into my office looking like a walking corpse. Got into this family process, got in, and his son Nick ultimately got sober, 7-8 years sober. And David said to me, he said, "Ward, I got sober off of IV heroin." And that was 30 years ago when they didn't have medication. You just had to bite on a belt. And that trigger, that craving was intense. He said, "I got sober off of an IV heroin addiction, but nothing was as potent as the compulsion to save my son. Nothing was as potent as the compulsion to save my son." And that's very real. And exactly what skews objectivity. Exactly why we say, through no fault of your own, and obviously not intentional, why a lot of times families are the #1 barrier to treating patients, is because that compulsion it's rooted in our DNA to protect our family and to protect our offspring from discomfort. And the problem with this, any sort of healthcare disease, what sort of treatment isn't uncomfortable? whether it's chemotherapy, radiation, or walking into a small group and being vulnerable. It's all uncomfortable and painful. You know, some of you identified patients that we talk about this. There's a lot of times that we say that you guys say, man, I'm feeling worse. It's like, since I started treatment, I actually feel worse. It's like, I hear you, you're actually feeling for the first time. That's why you feel it. We don't have the medicator or the that external thing to help anesthetize it, and you're actually feeling for the first time. And that's uncomfortable. It's actually healthy. It's not that you're getting worse. It's actually you're feeling for the first time.
I like to say, like, with codependency and families, we use those words, and it is quite shame inducing, because it sounds like naughty behavior, your codependent behavior, enabling behavior, and it sounds like we're like shaking our finger. But it's similar to, you're in a situation as a family that you are saving your child's life or your loved one's life. You're trying to keep this person alive. And whenever I think about that, I think about it, you're similar to if you're thrown into the ocean. Codependency is like treading water. Yeah, or maybe enabling is like doing the doggy paddle. You're doing things to survive in the situation that you're in. It doesn't mean that it's the wrong thing. It just means that it's not the most helpful thing, and we're not solving the problem. Yes, treading water is important, and doing the doggy paddle is important. It's going to keep you alive. It's going to keep your loved one alive. But in the end, we're trying to figure out what's the best way to get to shore, to get out of the water. And so when you hear professionals say those things, I would think, try not to over personalize and try to say, like, I'm surviving. And parents and family members will do crazy things during this time because your brain is shut off that prefrontal cortex and you're surviving off that amygdala gland. So you're really not doing complex math problems like you could up here in the prefrontal cortex. You're doing what it takes to survive. So I have mom and dads, and I've been in the same shoes. When something's happened to my kids, I don't make the best decisions either. And I'll give you an example of that. But I've had moms and dads come in and say, listen, you don't understand. We have to do it this way. We have to make sure that he wakes up and he has orange juice and that he has a bagel. Those two things are very important to start our day. And then they're like, listen, once he goes out and uses, I make sure I have 2 bottles of water and ibuprofen next to his bed at night. All these kinds of things that they do because that's what's helped them survive until that very moment. And so they get very rigid about that. And that helps them keep their kid alive. And if we're coming in to do an intervention, they'll say, we need to do all these things before we do the intervention. And a part of me giggles on the inside, but also on the outside. I know what it's like to try to keep your loved one alive. So I get that part. The other part of it is once they get their loved one in treatment, then the prefrontal cortex comes back online. They're thinking more long-term and like, what's life consequences and how. So then within 30, 60, 90 days, they're calling me and saying, listen, Brandy, I think he's done enough. He looks physically well. And we really got to get taken care of. He's got to find a wife. We need to get back in school. What about his teeth? His job. I was really hoping he'd start a 401k by the time he's 27 because it could get to this. And so they'll be calling me with these kinds of things. And I honestly think that's a great sign because that means we're starting to come back to our frontal cortex and we're happy about that. Also not the best thing to worry about at that time. Totally not the thing I'm worried about. They'll say, well, is he drinking organic juice? Because, that high C stuff has a lot of, like colors and, chemicals, and we don't like that. And so they'll start saying those kinds of things. And I'm like, ma'am, he was injecting heroin in his neck
He was
last
doing
week.
meth last week.
Yeah. The organic juice is not my concern right now. But I will say in that, good for you that we're moving back into that frontal cortex. Good for you. Good sign. And, he's going to be fine with whatever he's drinking. Also, we don't serve high C, but yes, he's going to be okay, And so people will call up and they'll say, that's the number. It's on our admission paperwork is stuff about dental because the mama, once she starts feeling a little better, she's thinking about those teeth that she paid for braces and dental care for all those years. And she's like, I need to get him to a dentist. We need all those teeth redone. And I'm like, ma'am,
We'll get
take
there.
a minute, it's going to be a minute. And I'll give you an example about my own because, when we're in this field, it looks like we know it and we don't, obviously. I know some things. That's why I graded myself a 9 last night. I was like, I'm a 9, but there's some things we don't. So like even in my own situation, a few years back, I lost my daughter in Disney World, physically lost her. She didn't die, physically lost her. And we're in there and she's, little, probably 4. And when we're walking around and all of a sudden she's not there. My whole front of my brain shut off. And let me say, I am a great person to have in emergencies. I've been used by the government. I've used by all high power people in an emergency situation. I am really good. Something happened in that moment. Like my brain did not work. I am running around telling people to freeze. Everyone in the park, do not move. Do not move. Nobody move. I'm yelling at this person, and they're asking me basic questions like, what does she look like? What is she wearing? So I'm trying to guess at what she's wearing. I'm saying, well, she's got on red pants. Get your ass out of that seat and go find the kid. Yelling at these people trying to find my kid. It's been seconds, by the way. It's not even long. It's been seconds since I last saw her. And I have no sense of direction. I can't find anything. I don't know where to go. I'm yelling at everybody. And then two minutes later, of course, we find her. And she's wearing the exact same thing as me. I forgot that we all matched. We went in wearing the same whole outfit. And they were like, ma'am, you couldn't think what she was wearing. You could have just said this. And I said, that's a great example of when you're in crisis, your frontal cortex is not working. You're not making, even someone who studies neurobiology for a living, it was not working. I couldn't do it to find my own child. So I don't expect you to be able to do it when your child's at risk with a life-threatening disease. So knowing that, it's best to find someone you can trust to make those decisions and give you guidance, because we are not going to make the best decisions in all that kind of time.
And that's not an indictment on her parenting. That's just a very natural human response to the traumatic moment.
Mhm.
And that's exactly why we'd say that emotional intensity skews objectivity. Family members cannot see each other accurately. And that's not an indictment. That's not a bad thing. We have this, there's a nationally renowned owner of a treatment center, and she actually owned and operated probably the most intense steel on steel boundary driven treatment, known for that. Went around the country speaking on it. The moment her daughter needed to get in treatment, the daughter would leave treatment and she'd do everything, do the absolute opposite that she had her treatment center. Her daughter would jump out of windows and she'd buy hotels and buy cars and buy this and buy that and buy that, anything to keep her daughter from any discomfort. Because that's the way that when it was her and her family, it was just completely different. Yet in the professional setting, she actually was the leader in steel on steel boundaries and treatment. It's just when it comes to our own family members, it just skews objectivity. And that's a very real part that when it comes to understanding the healing part of it, that's the awareness, the understanding why. That's important when we begin this process and the application of our recommendations. Because even you guys that experience previous treatment centers, I promise you there's somebody out there that will say, well, that treatment center didn't work. And I'm like, really? Or do we just not follow the aftercare plan? And that's really, if we're emotionally honest, we did not follow the professional recommendation. So we hear it all the time. There's plenty of people, they'd say, well, Blanchard didn't work. And we know that the family didn't follow anything we asked them to do. It's like, I hear you. And the reality is, like, what other disease would you say, well, that medicine didn't work? You never even took it. If you didn't take it properly. I was at my own doctor's appointment this week, and she just looked at me and said, just be an adult and take your medicine properly, Ward. And I was like, I know, I tell my clients the same thing. She was just be an adult and take it properly. I said, okay, yes, ma'am. And that's my responsibility. She had the same conversation with me that we have with you guys. And so this is what, when we're talking about empathy and understanding what each of you guys go through, like I said, it doesn't remove responsibility. It removes blame and fault. It's not your fault your body developed this disease. It's not my fault my body developed an autoimmune disease. It's not your fault that this is how the human being biology responds to trauma. If you think you can control that, that would be like me giving you a glass of chocolate milk, saying you drink it, just digest the chocolate. Like, you can't do it. Your body operates that way. And at the same time, it is our responsibility to have awareness of it and do what we have to do to recover. Like, it is my responsibility to go to my appointment on time, to get my infusion on time, to take my 12 immunosuppressants on time. And it is your responsibility to do what you have to do to treatment, both sides of the equation. That's why families, it's absolutely understandable when you expect the identified patient to follow professional direction, and 100% the same accountability is on you when we ask you to attend Thursday nights or Saturdays or this weekend. We hear it all the time. People call me at midnight panicking about their child, and I'll say, okay, I can meet you tomorrow at 7 o'clock. And they say, well, I can't, I've got tennis lessons. It's like, well, that's incongruent. You know, they were
Yeah,
suicidal.
they're like, but I'll take a bullet for my kid. I'm
Yeah.
like, well, miss the lesson.
Like I've heard it that they were suicidal. You were calling me at 1 a.m. 2 nights ago. And now you won't come and meet me for an hour because you've got Hamilton tickets. That's true conversation.
Well, those tickets.
And that doesn't mean that they're trying to sabotage, it's just that lack of awareness. And also when it comes to our recommendation, most of the time, both the identified patient and the family, it's usually the one that's uncomfortable. And we'll do whatever we can to avoid it. And that's that avoidance behavior that we talked about that's not exclusive to this disease, but just what our nation suffers from. The inability to be uncomfortable. Because that vulnerability, that biology, not psychology, vulnerability is our body's most potent fight or flight trigger. Vulnerability is our body's most potent fight or flight trigger. It's what escalates the fight or flight syndrome, whether a bear's coming at you and you're really vulnerable for at risk, or whether you're opening up to your spouse or being vulnerable and allowing yourself to be seen for the first time. Your pulse rate goes up, your limbic system activates. Vulnerability is your body's most potent fight or flight. And a lot of the things that we ask you to do in order to heal, you have to lean into that discomfort, and it puts you in vulnerable positions. You'll find that out throughout the day in some of the exercises we do. And it's uncomfortable. It's unnatural. And your body's naturally going to want to have defense mechanisms. That limbic system is going to make you want to go, I don't want to do that. I want to do that. I want to do that. That's why when it comes to what you want to do or what you think you need right now, I hear you. And that doesn't mean it's what gets healthy. And would you say that to an oncologist who says, here's your options? You wouldn't say, no, I want to do this, this, and this, and this is what I'm going to do. We would still take your opinion. You still got an opinion. It would just give you 3 options and you can choose. You're just not going to dictate something that's not going to work. And so it's about following that professional direction and an understanding that each of you guys are working with this level of cognitive functioning. So have some understanding and some patience and some grace with each other. I can't tell you, when it comes to this healing process, this is not a linear process. Nobody does this perfectly. Nobody does it perfectly. And judging success by a day or a week will be an emotional roller coaster. But looking at progress in 90-day chunks of time, how much healthier is this family 90 days compared to last 90 days, 6 months from now? And maybe they haven't been perfect in their recovery or their mental health issues, but 5.5 months in recovery is a whole lot better than 6 days every day stoned. Is it not? I mean, what do you expect? I mean, if you turn 5.5 months into recovery and have an occasional reoccurrence, we're not validating that. So don't use program language like weapons. We can do that too. You know, progress, not perfection, doesn't give you permission to relapse. You know, but also you want to acknowledge the reality of the situation, that we're not demanding perfection. It's about healthy progress. And so looking at it in 90-day chunks of time. And so all of this summed up, and we ended the night with as we talk about change throughout today, please keep reminding yourself that change comes from within. External reform comes from internal renewal. You know, external reform comes from internal renewal. You are going to naturally go to everybody else. You are naturally going to go to take everybody else's inventory. It's just going to be the natural human. If you find yourself doing that, just try to bring yourself back in. Bring yourself back in and understand that how well do any of us in any scenario, whether at work or a boss, change our behavior when we say, you need to do this and you need to do that? Not very well. Spouses, partners, how well does that go over? You know, so when you get an understanding of the best way to create change is be that change, be the change agent. And so that's why, in order to do that, in order to be that healthy change, to be that sort of spark that kind of starts this, you've got to really pay attention and pick up the mirror on yourself. And this whole family process from this point on, like I said, is not hyper-focused on what the identified patient needs. Is not hyper-focused on what the identified patient needs. It's what the general family system dis-ease needs. Because in fact, there's a lot of part of this, you know, families, and this may be difficult to hear, because you guys are in a parallel process, you guys need just equal, if not the same amount of support as the identified patient, and it's not out there for you. It's not out there. The healthcare system doesn't provide it. You know, we provide the most family services, and we have to do it for free because the healthcare system doesn't pay for it. And so although it's not your fault, those resources aren't out there. There's barely enough for identified patients, but they can still come in here and get treatment and get education and get support. And there's some elements of this process, they're healing at a different rate than family members are. And in reality, there's a lot of part of this that the identified patient is much healthier than the family member. There's a lot of part of this that and you can't hear that from the identified patient, but you can hear it from us. That there's some parts of this process that the identified patient is healthier than the family member because they're getting the resources that just aren't available for the families nearly as much. And so beginning to have empathy, and that means identified patients, that means you need to be the one to have empathy for family members, have empathy and patience for family members, and an understanding that we're going to have delayed consequences. I was 9 months sober before my brother said, I love you, I'm proud of you, and I still wouldn't trust you around my child. And I earned every bit of that. It wasn't venomous, it wasn't judgmental, it was said appropriately, and I earned every bit of that. There's a reason why making amends is down at step 9. I mean, because family members, how many times have you heard, I'm sorry, I'll never do it again? They don't want to hear it anymore because we've said behavior, action is what changes human behavior. They want to see it. And so it's called the delayed consequences of our using, delayed consequences of our disease, and it's a reality. Now I can't stop him from calling me. He called me this morning on the way here in the middle of a cold plunge. The son of a gun can't, my 2 older, uglier knucklehead brothers can't stop him from calling me, but they didn't trust me for a year. And that's a part of this process. It's a part of the healing process. It's part of that. It takes 2 years to stabilize the process. And so with an understanding of what individuals can do, but also those individuals aligning together can have a powerful impact. And so as we're getting ready to dissect the family, an understanding of what the sphere of influence is essential in helping this process heal. We talked about how yesterday we gave the example of that licensure professional, of how they've got that 90% success rate because the diversion program forces compliance, whether the patient wants it or the family wants it or not, forced compliance, 90% success rate. And over here in the general population, we are entirely dependent on educating the family and the sphere of influence with enough information and enough boundaries, most of the time in the first 90 days, because that's how long even most inpatients, even if you're lucky, last before they're out in the stream of life. And so you've really got to educate the family and sphere of influence in a short period of time before the identified patient is out. And so that doesn't leave very much time to educate and provide the family with enough information and resources to understand that the closer you are to this identified patient, when you're talking about sphere of influence, this is close family members, spouses, parents, and then, outer circle can be employer. The closer you are to this identified patient, the more impact and influence you have. And if you are in that center circle, I cannot tell you how essential it is for you to be aligned. You can disagree behind closed doors, but you have to be aligned when it comes to coming to holding boundaries and what the family system does. And so as we talk about the family system and go on from here, think about that sphere of influence and how important it is that you work toward alignment, because that collective alignment is what has the most impactful influence. It's never control. You never have control. You can put them in prison and you can still get drugs and alcohol in there. You'll never have control. Like I said, like established, don't even have control over our own thoughts and emotions. It's not about control. It's about setting down the appropriate boundaries that keep you healthy and that have the most impact and influence to create change. But that sphere of influence is what we're going to be talking about, the rest of the day. And so as we dissect that family system, like last night we talked about the catalyst. And now we're going to talk about when that catalyst hits the family system. Is there any questions about the review material or just the basic concepts of the disease? Does everybody have not an exact understanding, but when it comes to understanding the general concepts of the disease that each of you guys are healing from and the fact that it has that impact on you guys' brain? Does anybody have any questions when it comes to that we're all on the same page when it comes to that? Okay. And so, moving on to the understanding of the family is when we talk about a family and a family system, understanding, well, what is that when we say a family system? What exactly is that? And when we think about a family system, the image of a baby's mobile is what comes to mind. You know, this is that any part of this baby's mobile you shake and it has impact. No matter where you're connected. I talk to family members all the time. It's like, I'm not impacted by this. I disconnected from the family 5 years ago and it just doesn't affect me. I mean, you cut your family off 5 years ago and you want to say you're not impacted, but you haven't seen your family in 5 years, but you cut them off. By that very definition, you've impacted. And so whether you realize it or not, everybody's impacted. It's like the baby's mobile and you shake one of them and everybody else's just subconscious job is to try to balance it out. Just try to balance it out. Just kind of, it's like keeping all those spinning plates. Just as long as that almost like that white picket fence, if something happens, we're going to do everything we can just to maintain the status quo. Just that baby's mobile, that's what we're all attached and connected. And so an understanding of how are we connected is just a basic understanding of what a system is. System is like oak trees, bodies, and organizations that are, every system is linked together. They have components that are linked together by roots, roles, and rules. And we're getting ready to talk a lot about rules. But these components are linked together to achieve a common purpose and one common purpose only. You know, a family's meant to thrive and grow together. And those rules and roles are meant to keep that family close and survive and thrive according to their family rules and their family dynamics. And so family members, those components are members, and it is always a living and changing organism. Make no mistake, a family system should change in a healthy way. And the reality is we have an epidemic of failure to thrive in this country where you have, children that never leave the parents' house. What do you think that's a result of? So this is going to be interactive, even if I have to sit here quietly. I can do it.
Parents don't want an empty nest.
Say that again.
Parents don't want an empty nest.
It's all about the parents. It's absolutely. When you see it certainly is situational that sometimes a child has to come home. I'm not saying that's not, there aren't anecdotes where that's perfectly fine and healthy. But when somebody's still living there year after year, well into their adulthood, it is absolutely about the parents, their inability to change and adapt. And that's about their needs and their inability to change and their inability to, because that's what going from an dependent to an independent. And it should change. It has to change. When I've got two older, ugly knucklehead brothers. We're 3 years apart, all of us. And, my family was different when we were 3, 5, and 6. When we're 35, 38, and 39, it should change. When it doesn't change, that's unhealthy. And also, don't you think my family changed significantly when I got sick? Trauma changes it. Life events change. Deaths change it. And even an absent or deceased family member still has profound impact on the family. I grew up with one known grandparent. Her name was Meemaw. She's passed away now 15 years ago, but she still has profound impact over our family. How we do Christmases, where we go. We still celebrate it in Meemaw's. So my cousin lives in Meemaw's house. We still celebrate it like she's there. When I eventually got healthy and sober, I lived in California, 3,000 miles away from my family. I still had profound impact on how my family operated, whether I was there or not. Out of sight, out of mind is not exactly accurate. You family members out there, if we intervened and sent your child just to a different state, do you think you just stop thinking about them? To some degree, it may help, but it doesn't mean to just cut out of your life. Even absent or deceased family members have profound impact. I worked in Southern California in LA's Midnight Mission for a while in Skid Row's mental health. And that's sort of the doldrums where they burnt every family member bridge. And the homeless population, we still can treat this from a family system perspective. They still had a network around them that was their family. We need that to survive. We develop that. Doesn't have to be blood. It can be, but it doesn't have to be. But an understanding what creates your family system. And everybody's family system is different. Everybody's family system grew up differently. Components of your family system, individual components, had their own family of origin that alters, how they relate and connect. That's why when somebody says, well, I talked to my neighbor and their child who's the same age or their spouse who's the same age went to this treatment center, that doesn't mean that it's appropriate for you. Because there's so many different dynamics and different influencers in what somebody needs. And so an understanding of there's so much that goes on that can have influence in how your family and can that influence and impact. And so gaining awareness over what has shaped your current family system. What is your current family system? Who's a part of it? What shapes it? What has influence on it? How does it navigate its functioning? And most importantly, when it comes to family system, all components are linked together by rules. And this is the same for businesses. No matter if you're the highest and most distant corporate culture or whether you're a family system business, it is still a family, whether you acknowledge it or not. You still got employees linked together by rules, roles, relationships, achieve a common purpose. In my organizational consulting career, I used my MFT degree in businesses far more than I ever used my MBA degree when helping companies. It's all just a family system. And so thinking about your family, specifically when it comes to your rules, understanding of what your unique rules are is first, well, what are the rules for? They're there to establish expectations, attitudes, values, and goals, to establish who holds the power and the authority, how the power is used, and how members are expected to respond. You guys know if you're a matriarch or a patriarch family. Everybody around me that gets close to me and even works for me knows that my family's a matriarch family. Betty Kellogg, we call her the eagle every time she swoops in. Call her the eagle. That's because she's a force when she swoops in, but she always gives me some bird analogy about how she's doing. I'm just like a bird, the wind's beneath my wings and I'm flying high. And she gives me some aviary analogy every time she tells me how she's doing.
That's so true. I expected her to come.
She almost
I was
came.
thinking, where is Betty?
Yep, this used to be 2.5 days long, and she would come and talk to you guys on Sundays about what it was like when I was Wardzilla.
Yeah.
But that's everybody in my family knows that that we're a matriarch family. There may be some occasional things, situational things that we're patriarch, and we know to go to her. But we all know whether we're a matriarch, patriarch, or which situations, who holds the power in what situation. That's what the rules are there for, to anticipate how family members will change, dictate how members will communicate and what they will communicate about, whether there's spoken rules, unspoken rules, who holds the power. And then imagine that that's just how every family exists in just its standard functioning. And then you throw stress and trauma and chronic stress on top of it. It's like a pressure cooker. And anytime that we're scared and uncertain, we cling to things that are certain. So we cling to these rules for life or death, rigid. And any sort of change and disruption is frightening. That's why also that when you have these rules and you begin to say, well, it's not about right or wrong. Like I said, that's terminology you won't hear us use. It's about what is healthy and unhealthy versus what is functional and not functional. It's like there may be a rule that was healthy and functional 10 years ago that's not right now. And why don't you change it? Well, that's the way we've always done. That's not good enough. Rules have to change. Life has to change. Families have to change. When they get older, when somebody gets sick, things have to change. And so beginning to establish, and that honesty about what's really going on, and an understanding of, creating an environment where you can begin to talk about it, but also beginning to identify, like I said, who holds the power with what situation and why. And identified patients know it. Our disease thrives on it. Our disease thrives on it because we know that's the trauma triangle that we can create. That parental splitting, that family splitting that we can put, that the disease can hold family members emotionally hostage. Same way family members can hold the identified patient emotionally hostage. If they're not following the family rules, well, you made me do X, Y, and Z. If you don't do this, you're going to make me do this, which is categorically false. Nobody can make you feel anyway. But that's what we'll do, just to often protect the rules. Oftentimes, in fact, most of the times, the change agent, the healthy change agent in an unhealthy system is the first person to take the slings and arrows. And make no mistake, because we're going to talk about boundaries and that this afternoon. If you begin to set healthy boundaries, you're beginning to upset the apple cart, especially the person that holds the power. If you set healthy boundaries and anybody gets mad against key word is healthy boundary. If anybody gets upset, it's because they benefit when you don't have it. And so when you're starting to, begin to identify and change the rules, listen, there's this family process. Not everybody is aligned at the same time. Not everybody has the same understanding at the same time. Not everybody's on board at the same time. And you are absolutely going to experience some resistance because there's going to be people that's going to upset the power. It's going to upset the power. And I can't tell you how many times that families say, I hear you and I feel so much comfortable in that chaos. Why is that? Why is it that that chaos, that unhealthiness, we will absolutely instantly choose that as opposed to the new normal that we're talking about? Because it's familiar.
Yeah.
Absolutely right. It is familiar. We think it's safe. It's predictable because we're not vulnerable. Because vulnerability is emotional risk without guarantee. And if we've got rules that we can predict what's going to happen, we feel safer. This new normal of recovery is scary. We're vulnerable. Spouses, are they going to love me? Are we going to have the same relationship sober? Parents, are they going to need me the same way? When my family, when I finally got sober and healthy, I told you guys I'm the youngest, and I had a wonderful mother and father that showed us they loved us, hugged us, kissed us, never saw abuse or anything, never saw fighting, arguing. They were wonderfully respectful to each other, great roommates and friends. Never saw them hold each other's hands or lay on the couch, any of that. The day before I'm supposed to go away to college, the day before empty nest is when I got sick. And so for 5 more years, instead of empty nest, for 5 more years, they're hyper-focused on keeping me alive. And then substance use hits for a few more years. So they're hyper-focused on that. So after 9 years, when I finally got healthy, sober in my own life out in California, and they've got empty nest, what do you think they chose? 41 years of marriage, they divorced. 41 years of marriage, they divorced. Because instead of turning into each other and leaning in and doing the discomfort, they chose the easy way out. And I'm not saying divorce wouldn't have been the ultimate answer, but they didn't even lean in. We talked about yesterday, it's the gray divorce. Because hyper-focused on mom and dad, neglecting that spousal, and we don't know how to have those uncomfortable, vulnerable, intimate conversations. And then instead of turning in and leaning in and doing the uncomfortable work, we chose the instant gratification, get out. And that's what we do. That's what happens. And things have to change. You've got to identify those rules. Things have to change, have to adapt. When that empty nest happens, things change. Then when you've got, 3 independents in, your role as parents and spouses changes. That's not a bad thing. Your role as a mother or a father changes from when they're 15, when they're 25, 35, 45. They need you. They just need you differently. And so when we're thinking about that, it's real important to understand, what are your family rules when talking about this? What are your family rules? Because we want to hear them. I'll give you some examples. Children should be seen and not heard. What's healthy or unhealthy about that?
Last throughout adulthood or childhood.
What could last?
That should be seen and not heard.
And so
Age progressive, they need.
So what you're saying is that communicates to them they don't have a voice.
Mm-hmm.
What they're feeling doesn't matter.
Mhm.
That's absolutely right. That's absolutely right. Be nice to everyone. What's healthy or unhealthy about that? Say what? Yeah, absolutely. It's not reasonable. It's not humane. Being kind and nice are 2 different things. Being nice to everyone. If you're nice to everyone, there's a degree that you're not being authentic. And
Or
also,
protective
if
of
somebody
yourself.
harms you, what if somebody harms you? Why would you be nice to them? I'm not asking that. The opposite of that doesn't mean venomous.
Yeah, I'm saying, or protective of the self. Like if
Mhm.
you're saying, and a lot of women get into this when they are in, adulthood, of being nice to everyone means you can't say no, and they'll take on more responsibility and more they'll be in a relationship that's not healthy for longer. And then men will do it as well, where they're doing more and more responsibility because they're worried about saying no or being offensive or hurting someone's feelings. And guess what I always say is the world keeps turning. If you're offended by something I do, even though I have good intentions, guess what happens? Nothing, absolutely nothing. It keeps turning. The world keeps turning. So it's not that I want to go around hurting people's feelings or being mean or cruel, but being protective of myself and my time is also important. And I think this message is one of the messages I hear a lot as a therapist. I'm like, they'll say, well, I was trying to be nice, so I did this or this. And it's very traumatizing.
And it's important to realize not being the opposite of not being nice doesn't mean to be venomous. You don't have to be nice to everybody. Nice, and even as a professional, I teach therapists, being nice to everybody can get people killed.
Exactly.
Be kind to people. And sometimes kind means having compassionate, uncomfortable conversations, but being nice to everybody gets you killed. What are some of your family rules? What about boys don't cry? What's healthy or unhealthy about that? Can you tell me more about that?
Mhm.
It being older, it's healthy to cry.
Mm-hmm.
I would have been showing vulnerability, but it was taught to me as it was a weakness.
Yeah.
Mhm. Mhm.
It's shown as a weakness, absolutely. And it's inhumane. We feel it, and then if we're told not to do it, it's incongruent. And then we wonder why we have trouble communicating our feelings. It was a couple years ago, a 55-year-old man sat there on the front row and said, my dad never hugged me or told me he loved me, but it never bothered me, as he was weeping saying it. And it's an example of that because you've got to disconnect about, you can't connect. That's the lack of authenticity of connecting what's really going on. And he learned that when he was young. And so what are some of your family rules that you guys go through, that you grew up with?
Mom ain't happy, nobody's happy.
If mom ain't happy, nobody happy. That's right. That's right. That's what healthy or unhealthy about that.
Mhm.
Or it's a lot of times you hear, it's all what father knows best. What happens if dad is abusive to mom?
Yeah.
And also, even if he's not abusive, how much that belittles the mother.
Right. Or
Yep.
right.
And then there's a power differential. That's called parental splitting.
Mm-hmm.
Now, there's certainly some times where it's healthy discussed to say, hey, you're the best person to communicate to this child. But the general rule of saying, wait till dad gets home, he's the enforcer, that's a power differential. It's unfair. That's alienating.
What about keep the peace or don't rock the boat? Those houses where, why are you always causing the problem? You're always coming in here and rocking the boat.
Control your feelings, healthy or unhealthy about that. Why?
Express.
Yeah.
Tell me why.
Express versus
Yep.
control.
Repression the feelings, and you don't know how to healthily let them out.
Yeah. It's inhumane, right? We have humans. There was a professor that said any human that doesn't want feelings has dead people goals. The only people that don't have feelings are dead people. Human beings have them. And to say you got to control them, it's incongruent. It's inhumane. And so we wonder why we have this disconnect of how to communicate our feelings. And so let me just challenge you, if part of the healing process from the identified patient is learning how to communicate their feelings, well, there's some of us that have grown up decades and don't know how to do that. So let's have accurate expectations on how long it takes to do that. What about always look on the bright side of things? Why? Absolutely. Like I can tell you, there's a difference between positivity and optimism. Positivity can be unhealthy. It just kind of denies what's currently going on, kind of invalidates it. Always look on the bright side of things. Optimism at least recognizes there's something going on. Hey, it's tough right now, and it's tough, and I have hope for the future. And a lot of times, this is what I call people silver lining it. Who's that really about? Like when I got sick, I loved it when somebody said, always look on the bright side, Ward. It's all part of God's plan. I wanted to throat punch them every time they told me that. Because it was all about them. I was like, I'm not telling you to have a bunch of sorrow, but it's invalidating. I said, I'm 18-year-olds with a trach and an oxygen tank. Don't tell me this is part of God's plan. I don't want to hear that right now. Just want to throw it. That's called silver lining it. And it's usually about the person saying it. And so, yes, you raise your hand.
It's about that.
Yeah, no, that's absolute. Always look on the bright side of things. It's unrealistic. It's inhumane. like I said, be careful to get polar, like the opposite or not doing it doesn't mean the polarizing opposite. Nobody's saying, well, then wallow in the negative. So we're not having polarizing conversations. We're just saying that whether the rule is healthy or unhealthy.
Perceive that too. It doesn't just minimize you, it mutes you.
Yeah.
So you don't have, and I've heard all of those sayings all my life. There's
Mhm.
nothing more curious.
What stands
You're
out to you?
right.
What's the one that stands out to you?
I mean, that's a good one, or yeah, it is just because they are uncomfortable, they don't know how to handle it. And I mean, frankly, it was just white picket fence syndrome.
Mhm.
You know, if everything optically appears fine, and you know, it was just a way of sweeping things under the rug, and look where I am now.
Yep.
Mhm.
No, it's a, most of the time, like rules, like we said, they're to establish how people to respond, react, what you can talk about, what you can't talk about. You know, be home by midnight or call. Listen, that's healthy. Listen, my dad used to say, you can't fly with the eagles or hoot with the owls. Be home by midnight or call. We're not saying that rules are, there's some that are healthy, some that are unhealthy. And so women in the family are gentle and ladylike. Or I've heard, oftentimes I heard say they grew up with a rule, don't leave the house without your face on. What is that? I see many people shaking their head. Talk to me.
Feel like it's over exaggerating the truth.
What do you females think?
Not like you're a whole person.
Mhm.
Makes yourself look good and presentable, so.
Absolutely puts it all about the
Right.
superficial front. Invalidates who you are as a
Mhm.
person. All of that.
I have an example that my grandmother is my matriarch of our family, was before she passed away. And Katrina, I'm from Louisiana, you know, so Katrina was a thing. It's a big hurricane that came in, and she came to our house because we lived outside the city. And she brought, because this is how she was raised, where, you know, the gentle and ladylike and put your face on all that. And she instilled the same in me. And she brought, her essential kit was a butane powered curling iron, a battery powered light up mirror. And she brought two. She brought one bag for her and one bag for me. And I still to this day, every now and then, come across that butane powered curling iron and I giggle inside because that's what we were worried about, not water or food. We were like, at least we're going to look good when they rescue us off I-10, you know? So it's just a part of who she was, you know?
And especially like adults, look back, think back to your family of origin, whether it's spoken or unspoken, like appearance is everything. Don't feel, don't talk, deny everything. Can't tell you how many times patients have come in here and said, my family told me not to tell you this. My mother told me not to tell you this.
Often.
Happens all the time. They even keep secrets from us.
As a parent, you always teach your children, don't you ever tell a lie. Right?
Mhm.
So just so people can hear them virtually, says some people teach, don't ever teach your children how to lie.
Problem as an adult, you lie your ass off.
Yeah.
So what they, for people virtually, said, never tell a lie, but as soon as you have a problem with adult, lie your ass off because don't embarrass the family. And how incongruent that is. How that when you're talking about authenticity and being who you are and all that, how incongruent that is. That's all about the masks, the superficial, the protecting, all that unhealthiness. I mean, think of, and some of these guys that spoken and unspoken, we learn a tremendous amount from 0 to 7 and 7 to 13 that we don't even realize. How was physical affection shown in your house? Like I said, you heard what it was like in mine. There was no violence, no assault or physical, but I didn't learn that appropriate, healthy physical intimacy. I had to learn that. It's my responsibility to identify that, to learn how to do that. And so all this, you know, we learn from 0 to 7, like I said, it doesn't, and we look back, and that's why it is so important when you treat this from a family system and family origin. This is not supposed, nobody is looking back to blame. It's not at all what this is about. Blame, the psychological definition is the way people discharge their own pain, their own fear, their own insecurity. This is to look back to understand, to look back to gain awareness of these patterns are repeated in our current relationships. Generational patterns are repeated. And so this new normal that we're creating in your family, you've got to begin to identify what are the rules, what are healthy rules, what are unhealthy rules, And also the adults, the spouse, the parents got to be open to feedback because you've got blind spots in what are spoken and unspoken rules. And so an understanding of identifying and begin to gain awareness over what are spoken and unspoken rules, healthy and unhealthy rules, rules that we need to keep, rules that we need to change, rules that we need to do away with.
And then as clinicians, we're trying to work with you and the family member to give permission and understanding that you can give yourself permission to change these rules. These are arbitrary. They're
Mhm.
fake. They don't matter. You have the right to change the rules at any point. Now that you're an adult, you can make up your own rules. So like some of these rules of appearance is everything of like, we could be fighting it out at home, yelling and screaming at each other, cursing across the room, but we answer the phone like, Klingman residents, you know. It could be that the new rule is we don't answer the phone because we're in the middle of it, or we answer the phone and say, I'm gonna have to call you back. I'm in the middle of something, click, you know, that kind of thing. Whereas before you may have said, I have to keep this going now in my own family. And at any point, even if it's you as the parent, you can change the rules. You can say, I have been following this rule for so long and I really don't even like it. And I'm giving myself permission to change the rule or to change my mind about how we handle things.
And as we're getting ready to close, but one of the ones I wanted to point out, because this comes up quite a bit, is sort of similar to the rule of your value comes from what you produce or do. Something like this also comes out a lot in treatment when it comes to school and jobs, is that a lot of times family members or spouses think when it comes to treatment or expectations that all they need is go back to school or get a job. And although that especially with young adults, actually getting a job and learning how to become financially autonomous is an absolute appropriate part of the clinical treatment plan. And that's usually way down the road. I promise you, if it was cancer, you wouldn't say you need a diploma or a job to get better. And the reality is that's 99% of the time, that's about the parent or the spouse that wants them to that doesn't want to say that they're unemployed or needs the diploma. And I promise you guys that I have a cousin, that entire family went to a Tobacco Road school, complete alumni. There are buildings named after him. And at 22 years old, he struggled with substances and he needed help. And they wanted him to get his degree. And that last semester, December 16th of his year, he drank 13 beers and crashed his car into a single car and died, 23 years old. I promise you, they want their son back and not that diploma. And so when it comes to understanding that school and jobs, that's not going to create this value all of a sudden, it's going to make the disease go away. This is a healthcare disease. Help me understand how a job in school is going to be that impactful in treating it. It certainly is a part of the clinical process down the road. Absolutely. And that usually comes under the clinical guidance, not under family demand. And so an understanding of what are the rules and unspoken rules that you have, and beginning to gain an understanding of what those are, and also an understanding that this chaos, this emotional intensity creates the blind spots that you guys have. All that neurojargon about not having a frontal cortex, executive functioning, judgment, reasoning, sum that up without a frontal cortex, you don't have self-awareness. That's what that is. When you don't have a frontal cortex, you don't have self-awareness. It comes back, but in the meantime, as it's progressing, you know, it's all a process as it comes back. You guys have blind spots. Every human being has blind spots. And so that's why it's best to get a third-party professional to help have these conversations. What's healthy and unhealthy. Right now, you guys aren't the best judge of that alone. You know, because you're still trying to figure it out. That's why we said don't go home and start figuring out all the problems last night. You're not ready to do that. Like, this is a process. Got a huge foundation and a jump start. And so without that professional help, we do just what like the baby's mobile. Without that professional help or intervention, you know, we try to balance it out at whatever cost. Whatever cost, just like you said, at whatever cost. If you get in trouble, just lie, do whatever you can to protect the family. It's like The Sopranos. Whatever cost. That's what we do. That's what the baby would do. Balance it out, maintain the status quo at whatever cost. Certainly do whatever the power holder says. And that's what the family rules say. And so as we conclude today, or this morning's part, you know, an understanding of just that family system. And this is just a human being characteristic. a family, each family is formed by individual components that are linked together by these rules that you guys have, these relationships, whether it's blood, deceased members, non-deceased members, and beginning to understand what is the makeup of your family. What rules do you have? Because the process that we go through, family recovery, like I said, is not pure family therapy. It's family realignment and family restructuring. And so you guys, the process of healing is going to take some conversation about awareness and conversation and application, because application is the key to transformation, of learning of what are healthy rules, what are unhealthy rules, what rules, like I said, need to change, what rules need to be go. And that entire process is uncomfortable. And this, in order to get to this other side, like I said, we have to make you a little bit uncomfortable. And so, Erica, what's the break time that I'm allowed? 5 minutes? Does anybody have any questions when it comes to family rules? Okay, everybody take a 5-minute break. 5-minute break. Come back. All right, thumbs up. Wonderful. One of the things that I'd like you guys just to, some of you come up and whether it's after the workshop, ask what you guys can do. Because there's so much misinformation out there and so much unknown and uncertainty out there. This afternoon, the last material, we're actually going to talk about more action-oriented things. This was guys heard me say last night when I first started doing this 15 years ago at Betty Ford, it was a 5-day program. Families were required to come Monday through Friday, 5 days. And so when I moved back to North Carolina and Charlotte in 2016, we did it in 2.5 days. It was a Friday, Saturday, and Sunday. Then COVID hit, and we've, sort of adapted it to a day and a half. And so, we've obviously had to cut out lots of material unless some of you guys want to, stay here for 5 days. But one of the things that is often asked is, what can be done? And we talked this afternoon, one of the things that we do that we used to spend all of Sunday afternoon is what now? All this material, that we talked about the catalyst last night. And then this morning, we talked about sort of what is a family system. Now we're getting ready to go into what happens when the catalyst intersects that system. And then this afternoon, one of the last exercises we go through is sort of much more action oriented, like what now? What do we do from here? And we're going to talk about resources. And one of the things that we're going to talk about is you can't believe everything online. And although we very much provide resources, and just like any healthcare disease, are huge proponents of empowering, client advocacy and doing your own research. And the understanding of this field has no governance and no regulation. And any one of you guys can start a treatment center tomorrow, can get a license from the DHHS tomorrow, or call yourself an interventionist or open a sober living. And so there's no governance and radiation or regulation. And there's not much even we can do about Google reviews. Like, even acknowledge a Google review, you're also saying that they were there at the treatment center. There's even some conversation that it's even illegal for us to acknowledge it because it breaks HIPAA, because it even acknowledges that they're there. And so one of the things that you guys can do is there's no influence on what to say, but just give your honest opinion about your experience at the workshop. And so that's why we have these up. If there's anything you feel drawn to do or say, like I said, the only request is just to be honest. But that's why we have this up. That's what you can do. And that's why this has grown to be 300, is we want to give this platform to as many people as possible. And so that would always be very helpful in helping other family members understand, because I can tell you, one of the reasons, passions about doing this is when I struggled with this disease, when it was obvious that I had gotten through the fire of the autoimmune disease, that substances were going to impact my life. My family was fortunate and blessed to have all the resources at our disposal from Eastern North Carolina, and we couldn't find appropriate help. We couldn't find appropriate help. This is the early 2000s, and couldn't find appropriate help, Googling WebMD. And so we just didn't know the resources that were out there. And so this is a program of, attraction, and just, your honest experience, may impact another. Listen, the 2 most powerful words you can say to somebody when they're struggling are "me too." And so that's why we have those up there.
Ward,
One of the tidbits I really want to make sure to drive home, because I'd get on a soapbox when I feel that, the world sort of shames what we go through, whether it's the idea that I think professionals get tunnel vision on the chemical consumption and want to label everybody the addict and alcoholic, and even the material is, talking down to them. Same with family members, that, the material, they tell you to just shut up, do what we say, read Melanie Beatty, go to Al-Anon, and just set boundaries. It's like, that's unrealistic because it's been going on for 20 years. You need help too. It just can be very, very shaming. And the reality is that when it comes to doing the work that families do, when we say that it takes 2 years to stabilize this, that when families do the work, I can absolutely testify to that families come through this so much more connected, so closer than they ever were before. And that's actually called post-traumatic growth. It's actually called post-traumatic growth. We know even from neuroscience that when somebody experiences trauma and, cognitive dissonance, you can actually increase gray matter in your brain. You can elevate yourself to a higher level of functioning. And when it comes to recovery, and if you think about just in life, we're drawn to the people that display that resiliency. We talked about last night that the one thing that we don't have a choice over is trials and tribulations are going to happen in life. Those are things that we don't have a choice over. How you show up to them, what you do when that intersects, you do have a choice over. And the truth of the matter is that when we're at that fork in the road, that we're either going to go one way or the other. And that usually is dictated by how healthy we are internally. That's why we say external reform takes internal renewal. When things change inside you, things change around you. And when we're at that fork in the road, we all know people and have been people ourselves that have chose to be blamers, constant victims, don't take any ownership, constant excuses. We all know people that are like that. And we can actually, when we're in an unhealthy state, form an army of people to validate our unhealthy choices when we're in this state. Both identified patients and families do it, that when they want to make the unhealthy family choice or the unhealthy recovery choice, we'll form an army of people, or we certainly will avoid the one that knows better that'll tell us the truth. And so we have to understand that also when we're in a healthy spot, we usually choose the other way. And these are people that lean into the discomfort, that display that courage, that develop that resiliency. And those are actually people that we're drawn to when we're in a healthy space. Those are people that we're actually inspired by, that show that resiliency. And if you actually think about just human beings, the people that we're inspired by and impacted by the most, they've usually been through some shit. And so that's why when it comes to understanding healing from this disease and being in the recovery process, that's why we firmly believe that, recovery is your superpower. It really is. And sort of the cheesy anecdote that I'd like to actually give is, it actually happened several years ago. I was on a weekend trip up in Maine with my partner, Allie, who you guys met yesterday. She played the fun police role for a little bit here. And we were actually on this dock in the middle of Maine, in the middle of nowhere. And, at a family wedding. And I'm from grew up on a group of islands, and I'm a seafood snob. I don't like eating seafood where you can't see the water, just because that's how I grew up. And we were eating lobster by this like shack. And all of a sudden, all the townspeople go running down the dock. And I know that if local townspeople are excited, there's something neat down there. And, we walked down there, and there this purple and blue gigantic lobster was. And evidently, this is some species that's like 1 in 5 million, because that quality of them, they don't survive. And they were all talking about how unlucky this little guy was, because because there's so few of them and they usually die, and how unlucky he was. And they were starting to make jokes of lucky, and they started taking him out. And I said, unlucky? I said, where's that one going? I said, well, we just called the aquarium and he's going to live there. I said, where are these other ones going? In the pot. I said, who's the lucky one? And so your qualities, what other people may say is your shortcomings, are really your superpower. Really what makes you special, really what makes you remarkable. The last thing in the world that I want to be is status quo and ordinary. And so what you guys have been through, the resiliency that you guys developed through going through this. So one of the most accurate definitions of wisdom, as I hear, is experiential knowledge. And if you actually lean into it in the healthy way, I promise you that your family comes out closer, more connected than you guys ever had been. And identified patients, you're the reason for that. That's why we call you guys change agents. Your family would never be here if you weren't here. And so you're the spark that creates this. And I cannot tell you what an opportunity this is. I get that there's pain in the midst of it. That's why yesterday, the famous quote, that the C.S. Lewis quote that I have is, God whispers in our pleasure, speaks in our conscience, but shouts in our pain. And I believe that sometimes God uses pain as a megaphone to rouse a deaf world. And so this truly is an opportunity. And so I hope as we go through the rest of today and we talk about family of origin stuff and we talk about unhealthy caretaking, it's not even to indict you guys, because we're going to talk about behavior that absolutely everybody in this room is currently doing. And you're going to hear us say that's unhealthy and destructive. That's not an indictment. That's really an opportunity to change. And so this is about the rest of today, and all of this weekend is really about establishing hope, not about establishing blame, but really about giving you guys hope that this is an opportunity to really create significant change, in your family. Also, one of the things I wanted to touch on is somebody asked me when it comes to understanding about dual diagnosis and treatment and where somebody belongs in outpatient versus inpatient, because I mentioned that Brandy comes from an inpatient and a long-term care, and we have an outpatient, and how people decide where they go. And we talked last night that the disease happens on a spectrum, and that the word addiction isn't used in a lot of medical conferences because it's not in our diagnostic manual, and that we actually have evidence-based measurable ways that can assess where people need to go. It's not just throwing darts up against a dartboard. Granted, like we said, that there's not a governing body that mandates treatment centers use evidence-based care. We're actually a part of a group that submitted a law to North Carolina that mandated healthcare to operate by ASAM standards. That's American Society of Addiction Medicine. Blue Cross and Blue Shield lobbyists shot it down. And that we submitted this law that says that all treatment centers and all healthcare have to operate by ASAM standards. And a part of that that's just families find helpful to understand, and patients, is when you have a loved one that's struggling with mental health and substance use disorders, when it comes to deciding what possible resource they need, just like any other illness, you wouldn't call a doctor, describe it on the phone, and without even seeing you, they tell you what to do. They would say, come in, have an assessment, have an initial appointment, and we can get a barometer. And it's not about money or insurance and like that. It's just a reality. You couldn't possibly give somebody, a referral without getting a baseline. And there's actually measurable ways to do it. Most of the patients, all you guys came through here and went through this process. It's actually called a biosocial assessment that somebody goes through. And they come in and they have a conversation. It's actually a measurable tool that we use that calculates where somebody is, that assesses where somebody is from 6 different dimensions of their life. 6 different, and it's the most measurable tool we have, where the first dimension we get an idea of where are they from a physical dependence. That's about safety. Are they part of that 10% that's physically dependent that needs 24-hour medical detox? That's the first dimension. The second dimension actually is about comorbid medical issues. Like, do they also have medical concerns that impact their care? Do they have asthma? Do they have chronic pain? Do they have, dementia, liver issues? That's important to take into account. The third, dimension is really their emotional, and cognitive state, really taken into that mental illness component. How are their emotional and cognitive abilities? The fourth dimension is about understanding their readiness to change. Are they internally motivated? Are they externally motivated? We said motivation doesn't dictate it. It doesn't mean that we don't try to understand it. Like, how are they motivated to come in here because of external, because the law is forcing them in here, or are they walking here themselves? The fifth dimension is about understanding their treatment history, their reoccurrence potential. How many treatment centers or reoccurrences have they had?
How many overdoses have they had?
How many
Because we're really
overdoses have they
concerned.
had?
When you're looking at in versus outpatient, you're really looking at the deadliness as well.
Yep. No, and all this is, and then the sixth and final dimension is the family and home and sober environment and healthy environment, and getting these 6 dimensions. And also what is essential here at the Institute, and what I think is so often neglected everywhere else, is the understanding that you can't really get an accurate read if the self-report is coming from the person whose brain isn't working. And so we really try to get collateral information and contact the sphere of influence. We actually have a sphere of influence worksheet that we establish who are the main stakeholders in that individual's life. Can we get information from them? Can we get involvement from them? And we get all of that. Then we go through an assessment and it actually spits out a measurable term of what level of care they need. It's not just psychobabble darts up against the dartboard. This is why you heard me say yesterday that sadly, that prognosis hasn't increased in 40, 50 years. That's not because our tools haven't increased. Much like the medical demographic, we know what works 90% of the time. We know what has effectiveness 90% of the time, yet 7 to 14% of people receive it. And so just wanted to give you guys just one example of like when understanding what somebody may need, what level of care, you might hear the term, meet the client where they're at. That means meet them where they are on the spectrum of their disease. That's why you can't just call a casual friend and say their spouse or their loved one went to this treatment center. So you have no idea what they would assess with. What also goes into that diagnosis or that delineation of what level of care. It's a very medical process. And sadly, guys, the healthcare system doesn't know this. I spoke to a doctorate program and said, if you guys, who knows that, actually, can you guys repeat the ASAM dimensions? And these are graduates, doctorates. And they said, what's ASAM? And so that's the reality that you guys are facing, but that's very standard mandated process at most effective treatment centers.
And I'll say this about this too, like families, you can't help it when you go into a provider and they've done the assessment and we're giving you the recommendation. We might say, look, they really have a high level of risk here and we're going to recommend these options. Either you can do inpatient, at the very minimum to meet dimension 1, you're going to need an inpatient detox. That means they're going to have to be medically monitored 24/7, and it could take anywhere between 3 and 2 weeks to get medically stable. And then after that, you have some options. You can do the residential in-house inpatient program where they stay 30 to 60, 90 days, and then maybe do an extended care after that. Or because they've only been in outpatient treatment one time and they had some moderate success, you could do an outpatient level of programming. And that means they'll return home and they'll be able to go to work, but then in the evenings they'll go to groups and we'll do this. But the risk on this is that they may have to step up. Families, when they hear these options like this, you cannot help it but say, I want the thing that changes the situation the least. I want them home with me. I want them to be able to still go to work. I want them to still be able to see us at dinner time. I want them to come to church on Sunday. So I want this thing. So when you're trying to tell families what it is the recommendations are, in my mind as a clinician, when I'm doing that, I'm knowing that just like when a car salesman tells me the price of a car, I know that I want the better deal, right? And that's the same as family members in the situation. What I would ask when you're in that situation of trying to decide what's the best thing for you, I would say, what do you think gives me the best odds for success? I want to know what you think the difference of potential success is with this recommendation versus this recommendation. Now, someone like me or someone like Ward's going to tell you the truth. If you don't feel like that person has a great answer there, get a second opinion. Because this is a life or death decision. You don't want to do just what feels the most comfortable and keeps the status quo going. And you don't want to do just what someone who has a sticker on their wall or a diploma on their wall says. You really want to make sure that you're getting the best recommendation for level of care, because you do not want to be in this cycle over and over and over again. It really decreases prognosis and outcomes when you do this repeatedly.
There's no question that's it. Like when I got sick at 18 and at Children's Hospitals, the King's Daughters, and got a second opinion, everybody said, if it were my child, I'd go to the Mayo Clinic. We didn't say, what's the closest hospital to the Outer Banks? We said, how do I keep this child alive? And so an understanding of, and the reality also is it's in North Carolina and most the states, we're the state with the highest rate of overdose, the lowest rate of available resources of any state in the country. Like there's not resources out there. And so a lot of it is the art of what's possible, but there's no question that places need to be vetted, and that even most therapists in treatment centers, they don't know what's happening at most treatment centers. In today's day and age, it's actually important for you guys to understand this. Good, bad, or indifferent, because of the Affordable Care Act, millions of people get access to insurance and the industry exploded. and outgrew compliance and regulation. And so all of these treatment centers every 3 or 4 years change ownership. You know, I went to Betty Ford Center. I worked at Betty Ford Center, but it's under completely different ownership. It's a completely different company than what it was. You know, it all changes significantly. A therapist or local clinician has no clue who owns and operates it. We go and visit every place.
Right.
We go and visit every place we send to. And we're not financially attached to any place. Actually, it's actually important to know Brandy's here on her own dime. I'm not paying her to be here. There's no financial strings attached.
Right.
And so we go and visit every place. And I don't expect any treatment center to be perfect, but the only places we refer to is I can get the decision maker on the phone and they'll do the next right thing. And places don't know that. You don't know that. They're changing ownership so often every 3 to 5 years. And so
And most clinicians only know their 60-mile radius. So they may think, you know, something within their backyard is the best place that they know of. And that's not their fault. That's not their job. Like, we travel the country, we travel the world looking at treatment centers. So I happen to know Elizabeth's and I know Tanya's and I know Ward's, and I've been there. I've been a part of their decisions. I hear behind the scenes so I can give accurate information. Whereas some young, no knocks on the young, you know, graduate from school's got a diploma on their wall. They're 27 years old. They feel real hot shit, you know, but they don't know what they're talking about. They're making a recommendation of something they heard about, and it may not be something that they would even go to themselves, you know. So that's what you really need to think about.
And when we do recommend care, this is one of the only diseases in the world when you recommend treatment that people think it's a punishment. So you recommend inpatient, where you're just after money. And so guys, let me tell you that when you come to outpatient, Cigna pays me $178 a day for 3 hours. I run a nonprofit. We give this away for free. I've got a staff here that are working there. We're not after money. It's like when I had that surgery that you guys saw the picture of yesterday, I went in for a 3-hour surgery. It ended up being a 12-hour surgery, and I woke up in a coma and medically induced coma. Was that doctor after insurance money? Was he trying to punish me? Or when I was underneath, he saw something and the treatment plan just changed. And that's what happens. So the treatment plan changes. And parents, just because you told somebody, well, yeah, you can only have to go 30 days. And then you come here and you say, no, you have to change. Well, I told them it's only 30 days. I said, I know. And the treatment plans change. You're more informed now. It doesn't make you a liar, but treatment plans are fluid. That's why you got to trust in the plan and be fluid in the process. And when it comes time to say you need more treatment, or you need sober living, or parents, you need to come to this more, it's not a punishment. It's just we're assessing the symptoms and you need more treatment. If my doctor tells me I need another infusion, I'm not going to say, how dare you punish me? I just say, okay, what time do I need to be there? And so beginning to understand this is, if you treat this like a disease, it's actually, we can really provide you guys the best opportunity and the best prognosis. And the last thing I wanted to reference this yesterday, and this is very understandably, you know, a difficult subject for a lot of parents to accept and spouses to accept. When it comes to how a brain heals, especially neuroplasticity of a young adult, which I classify 18 to 30-ish, depending on the context. I was in my early 20s when I went to treatment, and they did not classify me as young adult because I was financially autonomous and had my own house and was living alone, wasn't dependent on my parents. But in general, 18 to 30-ish, and how the brain heals. You have to think about it when mental health and substance use disorders comes and develops prior to the brain reaching, you know, full development. You know, the healing process takes a lot more than just abstinence. You know, you're helping somebody become autonomous, assimilate, identify who they are, develop life skills, all of that. It's so much more than just an abstinent environment. Because I hear family, well, my house is a sober living environment. It's like, no, it's not. I'm not talking about abstinence. I'm talking about what happens in a recovery residence is about structured life skills. And also, most importantly, it changes the power differential. You know, parents, it's not your role to be recovery police or mental health police. And you don't want to do that. It's your role to be healthy adult parent to a healthy adult child. Recovery police is not appropriate. And that when they're in their house, whether you realize it or not, that's your dopamine trigger, that's your trauma trigger. And your brain heals less, their brain heals less. We're not saying that it's impossible. We're just saying the most optimal environment unequivocally is outside the parent's home. And most of the time, it's the same way for spouses. Most of the time, it is truly a healthy therapeutic separation. I can't tell you how many marriages we've saved because there's healthy therapeutic separation. Because you think about somebody with two people without frontal cortexes going at each other at night, one of them is somebody's dopamine trigger. Do you think when they go home from treatment that they have conversations that get them closer to their goal or further away? Further away.
I can give you some statistics that we just recently found on ours. So our highest success, we have a treatment center in Louisiana. We are able to take almost all insurances, around the country and Louisiana. But for Louisiana, it's a highly insurance dependent state. So a lot of people are looking for treatment that accepts insurance. It can work in network with their insurance. So we have a lot of people who come from Louisiana. We also, the majority of our people now come from out of state. So over 60% of our people from out of state, because our highest success rate are people who come from out of state with long-term commitment and families in their own program. So those three criteria, the family's getting some counseling, they're from out of state, removed from where they were before, and they're willing to do long-term, we have an over 85% success rate. And so now, especially in that young adult demographic, and we only treat men, so that's kind of a little caveat, but in that category, we have an over 85%. In the other category, we're still a great facility. We're a teaching facility, we're an amazing facility. But in the other categories, your success rates are beneath 50%. And that's being honest. Other places are going to tell you, oh, I have a 100% success rate or I have a whatever. We have great outcomes. But if you're talking about it's a local person, family's not doing their stuff, and they don't have any boundaries, their success is less than chance, at 50%.
And so when it comes to understanding that treatment, it is really truly a medical approach, and it's hard. It's even hard even for professionals, right? When I lecture to professionals, I say even as professionals, we'll acknowledge it's a disease, but we'll treat it like it's a choice. The gap in helping improve prognosis is the understanding the application of our services need to be treated like it's a disease. And that comes with the treatment plan and telling you guys what's necessary and deciding what level of care somebody needs. It's not just psychobabble, let me just stick my thumb up in the air and throw darts up against the dartboard. It's a very measurable, evidence-based process. Does anybody have any questions about, sort of that general information about how we begin to start the process and assess what does your particular identified patient need? Where are they on the spectrum of dual diagnosis? What level of care do they need to sort of start with, and how that process is done?
So I understand that addiction is not a choice, it's a disease. But where does willpower come into play? Because I have trouble believing that willpower doesn't come into play at all.
Yes, it absolutely comes into play. So I think a great question. So just so everybody can hear, the question was, I hear that that substance use disorders and mental health is a disease, that it's not a choice. And where does willpower come into play? Because I don't believe that willpower doesn't have any impact at all. And so that's absolutely true. And I really appreciate the question, because these aren't polarizing statements. Just like when we make an assertion, it's like, just because we say that it's a disease doesn't mean there's not willpower involved. And so when I have a disease, relapsing polychondritis, the willpower comes from my choice to follow the professional direction and take my medicine every day. And so absolutely, does choice have influence? Yes, it does. It is your choice of what you choose to follow the professional direction or not. That's the choice. That's where willpower comes in.
I think it's, are you willing to stay in? Because like our facilities, you can't lock door facilities in the United States anymore. So anybody who's thinking that you're going to lock them up, that's not really it, unless it's a psych ward, and that's only a temporary hold. So going to treatment, that's a willpower decision. Staying each day, that's a willpower decision. Following the recommendations, taking your medication, that's a willpower decision. Someone can come in on that number 6 and say, I have readiness to change. I'm really committed to changing. I'm going to do great. I don't want my wife to be upset. I'm going to stay home. I'll do whatever it takes to get sober. And I'll say, well, great. We can do this outpatient in this way, but it includes you taking an injection of Vivitrol, which means it's going to block your ability to get high every day. And they'll say, well, I'll do everything else. Anything else you recommend. That's a willpower decision. The willingness to delay gratification, which is a skill that you'll need in long-term recovery. It's a skill we all need as adults to be not assholes. But the willingness to delay gratification, that's a willpower decision. And that will help. Now we know Ward is recording.
You know what that is.
My 3-year-old will walk around and say, Alexa, do
That's coming out
this.
of the Sonos. I don't know why.
How in the world? So yeah, so delaying gratification, that's a willpower decision. I also believe willpower had some part to play along the way of getting to addiction. And a lot of us do, like the delay gratification, instant need for reward, that kind of thing that happens in early childhood. That's a part of a willpower thing, and that we want to start teaching that. That's why Ward's going to elementary schools and middle schools, and so am I now, where we're talking about this early on, that those skills are really needed for us to avoid coming into this path. So
That's-
all of those things matter.
No, so go ahead. You keep going.
No, that's okay. Yeah.
Great. I mean, great question.
Really good.
Because like I said, it removes fault. It doesn't remove responsibility. And that is aligned with willpower. Like I have to take my medicines every day. When I don't, my autoimmune condition activates and I have to go see my doctor and she'll say, Ward, just be an adult, take your medicine every day.
Yeah.
Like that's what willpower is. And so it's all about, that's the part. And most of the time in the beginning part, the willpower is realizing that you don't have the self-awareness to dictate that right now the willpower is, I need to follow direction. And so that's a tough thing to do. But yeah, very much you still have a choice. It's like same thing. We don't have a choice over the pain or the fact that we have the disease. We do have a choice of how we show up to it and what we do about it. Great question.
Really good.
Any other questions about that? Okay, the last few minutes of this series, we're going to continue to talk about, like we said, the catalyst that was last night, the disease, the family system that's done by components and rules. So what happens when that catalyst, that trauma, intersects that family system and the trauma response that the entire family system has? And so it's actually, what you see here is actually real life trauma response. And so this image came in 2019, and this was brought in by a father and a mother, and he was tracking his son's behavior. And this was one sheet in one binder that was about that thick, and they had about 3 binders. And it is tracking ATM withdrawals, where they are this, and it's actually impressively color-coded
It is great.
and
Yeah,
organized.
that's really well done.
And you know, the real truth of this is the only difference between him and you is he wrote it down.
Mm-hmm.
You know, because that's what goes on in you guys' head. And how many of you guys what I call the bank Nazi, that you guys have the bank accounts and the Track My iPhone has enhanced the trauma response of family members, or hired private investigators, or followed people down the road. I know that my family followed me down the road of where they're going and what they're doing, and just that dopamine obsession, the need to know. That's the trauma response on paper. And so how old do you think the child was? 44 years old. That was how old the child was, 44 years old. And so this is a very real trauma response. And this is what, like I said, the only difference probably in him and you is he actually color-coded it and put it on paper, but that's what goes on in you guys' head. That trauma response, that cycle that you guys experience. That's why when we talk about untreated substance use disorders, untreated mental health issues, that stress, that trauma, there's no intimacy in a family. It's the ultimate disconnector. Everybody's in sort of a chaos cycle. Even autonomous relationships in the family system, in the extended family system, can't exist without talking or reliant on the identified patient. And so the whole family is sort of impacted by this sort of trauma response. And the healing process as we begin, like the application of this leaving here this weekend, it's not going to be a linear process. Like all the family system doesn't hop on at once and it's all one big aligned sphere of influence. We call it triaging the family system, is that oftentimes different members of the family come aboard this, what I call the family recovery bus, at different states. You know, there's only so much you can do. You can't tell them, you need to do this, you need to do that. You can model the behavior and then they'll join it. And oftentimes siblings are sometimes join later. I think it's actually very common for siblings to be a little more angry, a little more resentful, because they have the family love. They just don't have the blinding parental love. You know, oftentimes, you know, they have a lot of understandable, you know, anger, whether it's, you know, watching what happens to their parents, or watching that detract from their relationship, or, you know, just the idea that, you know, they have that family love. They just don't have the blinding parental love. And it's, you know, not too uncommon that, you know, siblings are the last to join, but it is a process of triaging that different family members get on board at different times.
This is also a reason that we'll say, when we are recommending stuff to a family, we take away the autonomous decision-making skills of each individual family member. So it's not when the family member calls you up and they're in, let's say they're at St. Christopher's and they're like, Mom, the food here is disgusting and I'm sitting next to drug addicts all day long.
And they're heroin addicts.
They're a
heroin
heroin and
addicts.
all I did was pills. Mom, get me out of here. Your mom reaction is going to be like, I'm on my way. Say less. I got my keys out. I'm walking out the door. And so what we need is a family unit to make those decisions with input from the treatment team. So I always tell families, I'm like, no one makes a decision alone. You're not deciding this from one phone call. Nothing's decided within the first 3 hours of a request. That there's time for family members to discuss it amongst yourselves, or if you need a treatment provider or a treatment team needs to be involved, then you give it 2 days. And I tell the patient as well that this is going to take, you should expect less of a response. Expect more time to go by between when you request something and when the action is taken. And also, you're welcome, because I'm building your ability to delay gratification. So two for right here. We're doing 2 things at once. That's what you have to do, is start building that ability, even though you might know the decision you want to make. And even if it is the ultimate decision, we're delaying it by time and duration over days, even with the treatment team. No one individually is making those decisions.
And it's because that we come into this trauma, this need to know, solving the next immediate crisis, just panic constant. If we text, we don't get a response right now, we need to know. And then if you come inside a healthy organization, we're the ones that's like, oh, pause, slow down. What you need to do is do nothing. Sometimes that's difficult. You know, family members and identified patients suffer what I call ADS disease, always doing shit. So always need to be doing stuff. You know, but the reality is, and we're going to finish up here in just a bit, is the trauma bonded system is usually characterized. I can also tell you, even as an interventionist, 2 out of 5 scenarios, we're usually putting at least two family members in some form of treatment. It happens all the time. I mean, the stress, the chaos that happens if you have a spouse or child in a treatment center, then you go to your general practitioner, you can't sleep, and they give you, you know, Ativan or Xanax, or all of a sudden you start having 3 glasses of wine instead of 1, and just sort of develops into a substance misuse, and that pattern's taken off. Happens all the time. Or that there's extreme religiosity, rigid thinking, workaholism. Like I said, the most addicted, obese, medicated, in-debt adult society ever. It's because we all got those patterns of medicators that we all go to. Unhealthy coping mechanisms. When that stress and that trauma hits, we go to those unhealthy coping mechanisms. And a lot of times we learned that when we were young. But these are often unhealthy patterns that we see, you know, quite a bit. And all of that is about, even as Brandy just referred to, this short term. I need this. And that's the way that you kind of try to put it. Well, let's just put them in this treatment center. As long as they go there. Like I've had intervention calls all the time where we're assessing and putting them into the proper treatment center. And all of a sudden they're coming, well, I put them in this place. I said, well, they do butterfly therapy and Cindy Lou likes butterflies. And it's like,
Yeah.
how in the world did you decide that? That was just instant gratification that got them into a place that stopped their instant anxiety. And that's like, well, that's fixed. And so that's where families getting this. And like I said, this also part is not your fault. You do not have a healthcare system that is guiding you. And it's also the reason why Googling WebMD and you deciding what treatment center to go to. And you've got an industry that's not governed. And the majority of them aren't treating people honestly. And that's grossly unfair. And it's the reality that you're navigating. And so this is a reality that happens when you're traumatized, like, I need this fixed, I need this fixed, I need this fixed, I need this pain to go away, I need this pain to go away. And like Brandy said, absolutely, before you receive proper help and support, you're keeping them alive. You're just treading water. That's exactly what you're doing. And when it comes to the proper healing process, that's when it's time to realize that that's no longer needed from you. Now it's time, you deserve time to practice the self-care and get the help and support you need. And so understanding of what exactly unhealthy caretaking, the trauma response, often referred as highlighted as codependency in the field, is that extreme preoccupation with or dependency, like we talked about last night, the hyper focus. That means that out of balance dopamine, the hyper focus on another person, activity, group, or idea, that is the trauma to the brain, kind of resets that survival mechanism, that out of balance dopamine. And as we talked about, when there's out of balance dopamine, relationships and resources go by the wayside. And so one of the things that is also helpful is an understanding of we develop these patterns of how we respond in stressful situations, how we respond, how we cope with emotional situations. We learned a lot about that when we were younger. Like I said, whether it was the firecracker puppy or learning how you once would handle stress, you learned a lot about that in the family of origin that you grew up in. It's actually called generational patterns. And so I've got a video that we can, helps us all laugh at. And it helps to have some healthy humor at times.
Hi, yes, I'm with the Surfrider Foundation, and I was hoping you would sign this petition to help us ban plastic bags in Oregon.
I don't think I want to do that.
Oh, a skeptic, okay.
I think I need to read the appropriate literature before I sign anything.
Okay, here you go.
Thank you.
Yeah. Hi, how are you? I'm Sarah.
Hi, I'm Chris.
How are you? That's our son, Alex. You just spoke to him before.
Yeah. Could you just explain, help us to understand why you would shut the door on our son? I'm the type that I have to read it first, have it right in my brain, and then I'll decide.
Yeah, but he's the type, and we're the type that needs instant answers.
That's unfortunate.
It's actually fortunate because that's the way that a person learns.
You know what? Let's try it again.
Let's try it again.
For Alex.
Hello,
Alex. Okay.
Nice to see you.
And what was the name of your organization?
The Surfrider Foundation.
All right, son, you did.
That sounds
You
convincing
did
to me.
so good. Have you read the literature though that you're?
Hey, listen. Literature is one of those things that everyone knows. No one seems to look there. I think you're going to be fine
What?
as long as you know it. This kid's a good guy.
I'm sure he is.
You know, just sign the damn thing. You know,
Close the door.
you're nice.
Thank you. Can I help you?
Hi, I'm from the Surfrider Foundation. And
My name is Alex.
My name is Alex, and I was hoping to petition to help us ban plastic bags in Oregon.
Tell me more. Just making sure you're smiling at him. Tell me more.
They cause pelican cancer.
They don't cause pelican cancer.
Who knows?
Does it say it in there?
They do.
Can you show me?
Shrug. And
That means
enter
what?
conflict. That means it's for you to decide. He's doing pretty good.
Well, not if he's telling people plastic bags cause pelican
Okay,
cancer.
let's try this. Just move your mouth and I'll just do it for you.
So, well, you look pretty great. I mean, I think everybody looks pretty great. I mean, people in general, they're always looking good and they're trying their best. Anyway, well, hey, listen, just sign it and let's get out of here.
Get a life and stop smothering your child.
I failed.
No, you didn't.
That's all I did.
Hi, I understand that my son and his wife were here because you wouldn't sign my grandson's petition. And I was just wondering why you won't sign the petition. I feel like I haven't done my job if they can't convince you. They did a good job, didn't they? Just sign it. Oh. Oh.
I think we should go to ice cream.
Ice cream.
Ice cream. Ice cream. Ice cream. Ice cream. Ice cream. Ice cream. Ice cream.
You hit the lights.
Yeah, I loved it. I loved it. I
know
feel like I've had a million people like that in my office.
Yep. No, it's you're not hitting the lights.
Oh, yeah, that-
That is actually, we laugh and we chuckle, and not too far from the truth. And it is absolutely something that is a generation. Did any of you guys identify with any of that? That's knowing laughter, that I can read body language like fluently. We all know people and family members like that. And so you can begin to understand it can be generational. These are generational patterns. And so understanding, looking back to, not to blame, but look back to understand. And also beginning to, like, what one of these patterns are, may intended to help. But, one of the things that family members and professionals agree on is that the family needs help. The disagreement is what that help looks like. And so understanding that unhealthy caretaking can come from a variety of different, foundations. Most of it comes from historical family of origin stuff. How do you cope with stress and anxiety? How were you taught to cope with stress and anxiety? And also when it comes to, setting healthy boundaries and, people's autonomy, if, that external need for validation, that's why, what do you think, who do you think those issues, what was the root cause there? Who would you? Grandparents. You certainly wouldn't fully blame the kid. Certainly he has responsibility. He's not blameless, but you can say there's certainly the parents there. And you can see when we say that when it comes to treating the identified patient, the biggest barrier we have is family. And it's not intentional. We absolutely understand that. And it's still the reality. The biggest barrier we have is family. And so beginning to gain awareness of, yes, the one thing that we are absolutely lockstep in is the idea that the family and the identified patient needs help. Now, what that healthy help looks like are two different things, because you guys go through a parallel process, but the actual family disease process is a chemical imbalance in y'all's brain. That hyper focus, that preoccupation is a dopamine imbalance that needs to be reset. That's why that there's the structured, properly vetted recovery residences, whether you're an identified patient, whether you or a spouse or a child. One of the major benefits is it allows some healthy space for that dopamine reset. And I can't tell you how many marriages are so much more healthy because the first 90 days in treatment, the spouse was in a structured recovery residence. How that truly was a therapeutic separation because of that chemical imbalance that happens. You guys have the same symptoms, behaviors, feelings that you guys go through. And one of the most important concepts that we're going to finish up on is this perception filter that happens as a result of the trauma that you guys go through. This perception filter is what trauma shapes. You guys, everybody in this room has it. What you've gone through in life shapes your perception filter. What you experienced 0 to 7, what you grew up with as a teenager, what you've grown up with and endured as a family has shaped your perception filter. And so when you guys have a response, when you guys don't get a text message back or don't hear from them, your perception filter tells this story. In the absence of facts, you will tell a story. You will tell a narrative that happens. It's that future projection, that catastrophic thinking. I mean, how many of you guys that if you don't get that text back within a few seconds, it is bam, 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 bam. You're just continuing to text. Or if you're at least not texting, that's what's going on in your head.
I'll say too, when we're younger, 0 to 7 is where we start developing these filters in our life. So a lot of neuropsychologists who study children can talk about attachment styles and reaction styles based upon the ages 0 to even 7. So there's a thing called StoryStem, and this Dr. Tim Page did a lot of research around this, and he'll bring kids in for counseling who are having outbursts or reactions in school or whatever. And part of his activities is StoryStem. He'll start the story and then the child will finish the story. Just like right now your brain will do for yourself when you don't receive the text message, the same is happening at an early age. And what happens is there's automatic response and reactions that are developed in our early childhood. Even though some of us are beyond the youth age, we still have these automatic responses set in. So an example, and I'd like you to think about it in your mind, is there's mama bear, daddy bear, brother and sister bear sitting at the table, and little sister bear carelessly, as she's playing at the table, knocks over her glass of milk. Now, in that moment, there's going to be something that happens at the table. Your story, the rest of the story that you create in your mind, is based upon the filters that you developed at that early time as well. Unless you've taken active measures to correct your story stem is likely rooted in your early childhood. So, for instance, if I were to tell that my initial reaction, how would things have been handled in my house? It would have been, Dad's going to yell about the milk being spilled because mom's going to, there's a mess to clean up. Mom's going to act overly dramatic, like a martyr having to clean up some milk. Like, oh, I'm having to save the world by cleaning up this milk. And Dad's going to be punishing and yelling, why would you be so stupid to play at this table like that? Don't you know we're here to eat? You know? So that would have been the story stem in my situation. So now when my kids are young and I'm the mama bear sitting at the table, taking corrective actions, I try not to be the one that's like acting like a martyr, cleaning up the milk. But every now and then when I'm cleaning my house, like the other night, I got home and the cleaning ladies had come and I thought, I'm coming home from being out of town. I deserve to come to a nice clean house, you know, but I have 3 children and that is a delusion in my head that I'm going to come home to a nice clean house. So I come home, the house is as one would expect with 3 kids. And I just lost it. I turned into exactly my mom. I am shouting, get it downstairs, get it downstairs. I'm opening that dishwasher and slamming it shut. I open up the cabinet to put something away and I slam it shut. And I'm throwing stuff around like, who put this here? Who left these shoes here? You know, this kind of reaction. And my kids are scared. My daughter is 14 and she's hilarious in a lot of ways and sassy in a lot of ways. And she said, what happened? You had a bad day? You just decided to blow up here? And I was like, I honestly was still a little bad at the moment, but it like took a second. Then I kind of was like, I mean, that's fair. Fair enough. I had a bad day, came home with unrealistic expectations, and my old filter came back on. Whose responsibility is that? Mine. But also I can't blame me for the way I had to grow up or what happened in my story growing up. So, but the responsibility is still mine. So if we're saying like these filters that we develop as kids, they stick with you. How do you handle when someone breaks a dish? How do you handle when they don't eat everything on their plate? How do you handle when someone says it's an emergency? What's your reaction? Are you a freeze or are you fight or flight? Those kinds of things develop early in life and they stick with us forever. And it has an impact on those that were around.
Yep. There's no question that your perception filter is shaped by a tremendous amount of life events, family events. And understanding that, especially that's in a normal scenario, especially under the intense pressure cooker of what you're in right now, it just emphasizes it. And so your body goes immediately to its known coping mechanisms, and that's where this perception filter comes in. And that's exactly why when it comes to families and patients choosing the treatment, that it's significantly impacted by your perception filter. And that's why when it's left up, that's why not the healthiest decision is often made. And this is tremendously understandable. It's a very, very human response to intense trauma. And the reality is, and you've heard, Brandy even refer to it, is learning how to develop that pause, that self-awareness, that knowing not to react. It's one of the, whether it's communication or just, reacting, everybody reacting instead of responding, and learning how to do that. And the problem is we're not good at patience, just human beings. In fact, there is an interesting and telling research article that took 4,000 human beings and said, you can either go in that room and do nothing for several hours or do that and be patient, or that room and you can give yourself electric shock. How many people do you think chose being patient versus something to do and give themselves electric shock? 75% chose the electric shock because we're not good at human beings, just being patient. And the opposite of patience is not impatience. The opposite of patience is fear, anxiety, intensity. And that's just something, discomfort. That's what we can't stand. And so that's why we need this instant gratification, especially when we're exhausted and we live in this world of exhaustion. You know, but there's this also a telling quote that, by Margaret Thatcher that says exhaustion makes cowards of us all. Exhaustion makes cowards of us all, because when we're exhausted, hungry, and lonely, tired, we're making that easy, comfortable decision. And so that's why when it comes to making these intentional healthcare decisions, that you want people responding instead of reacting. And right now, especially the first 90 days to 6 months, that family members and identified patients, you're just in the healing process as you guys are learning how to have the awareness and learning how to respond. And so because we're a little bit over, we're going to end there and go on to it. Does anybody have any questions, when it comes to that unhealthy, caretaking and that codependency, when that trauma hits the family system, and each of us have our own individual coping mechanisms that preoccupation, that obsession comes out. And some of us are catastrophically the opposite, just complete avoidance behavior, just disconnect and detach and completely stonewall everything. That's equally as unhealthy. And so understanding, well, what is your perception filter? What shapes your perception filter? Gaining awareness. Like I said, that's the first part of the solution, is gaining awareness and understanding why. Does anybody have any questions? Okay, Allie, would you mind coming up? So before we break and go into the next exercise, one of the things before I hand it over to Allie is we are going to go into a different exercise in around small groups and much more interactive. One of the things I just really wanted to mention is this small group is by far what people who've never experienced are the most uncertain about. But on post surveys, unquestionably, what we get is, man, I wish you had more time for small groups. I wish you had more times for small groups. What I'd like to say about small groups is it is one of those things you get out of it what you put into it. Meaning I hear all the time, well, I didn't get anything out of it. I'm like, did you say anything? Nope. Did you speak up? Nope. Did you ask any questions? Nope. It's like, well, no kidding. And you get out of it what you put into it. And also, really, when the small groups go, this is not a small group to give advice. You're not there to tell people what they need to do. Right now, nobody in this room is in a position to tell somebody what they need to do, because you don't know really what's going on. We just described that there's so much that's going on, but you are there to tell how are you impacted, what you experienced. Maybe you went through something that's similar for you. You absolutely are there to share your feelings and what you're processing and what came up for you. So try to refrain from telling people what they need to do, and really keep it about you. Really keep it about you. Try to stay away from hyper-focusing on the identified patient. This group is about you, your feelings, what you're going through, what you're experiencing. And this is a tremendous resource that you'll find out this afternoon, that those of you who have attended Thursday nights, especially for family members, that you have access to something like this, beyond this weekend. And so, Allie?
Just one more thing I would just want to mention. We talked about it last night, but confidentiality in these small groups is incredibly important. So as we talked about, please, who you see in that group, what you hear in that group needs to stay there. And that's particularly really important for our clients who may be in a small group with your other client family members. And as you know, just from being in small group, the way that Ward talked about it being safe, secure, and connected is by that being confidential. So please, 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 if there's nothing else you are getting from my fun police talk, please, by all means, keep that confidentiality in that room. Okay, it makes it really special. So
She's about to divide you guys up, and guys, have patience. We've been doing this for 8 years, and this first time doing it, because you never know who's going to be here on this given day. There's no other way to do it other than this way that Allie's about to do.
Yep, absolutely. And so we're going to do that by building, correct? And virtual. All right, sounds good. All right, so we're off live. Hot dog. All right.